Yo, what up, a-holes? Thank you for tuning into the Holistic A-Hole podcast. My name is Erik Levi, and I'm the Holistic A-Hole, the mommy blogger with balls, the inconvenient truth of health. What's up, y'all? Hope you had a good weekend. It's Monday Fun Day. Hope you're staying healthy. Hope you're ready to detox all those bad weekend decisions you made, or maybe they were the best decisions you ever made. But I'll tell you what definitely is the best decision that you've made. That is to tune in to the Holistic A-Hole podcast. I almost forgot what was the best decision. No doubt. Tuning into the Holistic A-Hole podcast, where today I want to talk about health insurance, my favorite topic that I ever get to talk about here on the podcast. Because if you remember from a month ago, all the a-holes who have been here for the last month, I recorded a podcast where I talked about this argument that I had with this freaking guy in Washington Square Park here in New York City. If you haven't heard that yet, you want to, after this podcast, go check that one out to get a little reference point here. I think it's called What I Learned from Arguing with Hypocritical Liberals or something like that, which was very apropos, as they say. And I've been thinking about part of that discussion that I had with this guy that just it like threw my brain into like a vice. You know what I mean? Where I was like, wait, what? What are you talking about? And I've just been thinking about this, and when it comes to healthcare, and something he said, and I want to address that here on this podcast, maybe even the next podcast. I have a feeling this might be a two-parter here, but I do want to get into all that. We're going to talk about health insurance, especially if you're becoming an a-hole and you're starting to really doubt the efficacy of the health insurance industrial sick care complex in this country, but you just need a little ammo to kind of get you over the edge, to kind of convince you that the whole thing is just a bad idea. This idea of everybody talking about universal health care and everybody gets health insurance, and these arguments that these people make, against Trump and against the ending of Obamacare. I want to give you some information here that I've dug up just looking around the old internet here, and it's going to be very very interesting, especially if you're kind of starting to sway to the side, or if you're one of these liberal people and you think that you think that everybody needs health insurance and we should just tax the crap out of everybody in the country to make that happen. I think you'd be shocked to get this counter argument to one of the biggest arguments that side has for the for-profit insuring of people for health insurance in this country. So before I get into all that, I just want to just remind you, if you're new to the podcast, you haven't done this yet, make sure you subscribe to the podcast. Putting these out every single day in the month of October. And then after that, who knows? Who knows where they're going to come out? But you want to make sure you get this popped up in your feed. So make sure you just do the easiest thing you're going to do today, which is hit the subscribe button right there on your phone, your podcast player, your MP3 player, your Discman, whatever you're listening to this on. And when you enjoy the podcast, which you are no doubt going to do, make sure you go on over to iTunes or right there in your Apple Podcasts in your podcast player and give the podcast a 5-star review on iTunes, and then go on over to the Holistic A-Holes Facebook group. That's Holistic A-Holes with an S Facebook group, and join that, and like the Holistic A-Hole Facebook page, and then follow me on all the other social mediums, Instagram, Twitter, YouTube, all Holistic A-Hole. So first off, I just want to address something when it comes to this argument that I start to have, that people kind of get confused by, right? Because I say this thing that I'm not for universal health care. I am not for a one-payer system. I'm not for everybody in the land just having health insurance. I think that would be a financial catastrophe in this country. I think it would be a medical catastrophe in this country. I think we would severely limit the access to good care for people who genuinely need it. And I just think it's an overall bad idea, and it does not solve the problem. And even bigger than that, I really believe it's anti-evolution. If you're not doing your part to keep yourself healthy and to keep yourself alive, I mean, this is what evolution is. The weak die off and the strong survive. We can't have a country full of just, sick, dying people just because you keep going to your doctor to get little patches put on your sniffles and on your weird illnesses that pop up, or your diabetes that you can't seem to manage or get over, and all this stuff, right? We have to have some kind of, hard line where we say it's time that you start taking care of yourself, right? That doesn't mean to say, here's where the confusion comes in, that I am anti-health care. Right? I believe that everybody has the right to health care. And despite what you think, where you're, confusing the idea of healthcare and health insurance, you do have access to healthcare. Everybody does, okay? I haven't had health insurance for, I believe, 5 years, maybe even 6 years now, and I have not had access to healthcare, okay? Once a year, I go to this doctor's office around the corner from my house, and I sit there, I wait in his office. It's usually a 2-hour wait, and I go in, and I get my blood drawn. I get all of my, vitals taken. I get my blood pressure taken, and, because I'm, an a-hole, I kind of know what I need to check, so I'll just say, hey, I want to get this blood test, and I want to get sent to this lab so I can check my micronutrients, my vitamins, my minerals, all of my, blood work, and, just basically get what we would call a checkup, just so I can know, are my kidneys bleeding? Is my liver, doing what it's supposed to do? Do I have all the right enzymes functioning correctly? Is my blood glucose, not shooting through the roof? I need to check all that stuff. And I can still do that. It's just going to cost me money out of my pocket because I don't have an insurance company going to bat for me, And everybody has that ability. You can go to the emergency room, which is not the smartest thing to do. In fact, I'm going to bust a huge myth about that here later on in the podcast, okay? So you do have access to healthcare. This idea that if you don't have health insurance, you don't have healthcare is just totally wrong, okay? You too can go to your doctor if you need to go to the doctor, if you need to get, some kind of medication, if you need to get antibiotics, which, Jesus Christ, don't get antibiotics unless you are absolutely dying, unless you have some kind of infection and it's bubbling over into your organs. Jesus Christ, get off the antibiotics. There is no need for them. Your body is built to handle what most people use antibiotics for, okay? But if you need to go to the doctor for something, you absolutely can. You just got to pay out of pocket, and it's really not that bad, okay? You go in, you spend, I don't know, usually it's like $100 or something. That gets you in the door to see the doctor. Now, if you're going for just a regular checkup, it's you'll get the reflex test, you'll get your blood pressure, he'll put a freaking popsicle stick in your mouth, make you stick out your tongue, and then you can opt for the blood tests. And then that's where things get a little interesting, okay? Because the blood work can be kind of expensive. Labs tend to be quite expensive, and depending on what your health situation is, it could be more, and it could be a lot more sometimes. So to get the panels that I usually get, usually goes for probably like $500-$600, and I get a lot of work done, okay? Now, here's a little trick that you can do. And this is a little fucked up, I'm not going to lie, but it works. And if you're taking your health in your own hands and you've just decided that you're just going to live without health insurance, you're just going to be okay doing this yourself, and you don't need the doctor. You've decided that you can read enough books, you can read enough stuff online, you can listen to the Holistic A-Hole podcast, and you can get your health situation in check, right? You go get your blood work done, bill comes to you, don't pay it. Don't pay it. Just let it sit there on your desk, let another bill come in, and then maybe a month or two later, they're going to start threatening to send you to collections. So what you're going to do is you're going to call up the lab, and you're going to say, hey, I would rather you not send me to collections. What can we do to work this out? And this happens almost every time for me. Without even batting an eyelid, the person on the other end will go, okay, here's a 60% discount. Here's a 70% discount. So what was like a $500 bill has now been drastically reduced down to $200. Okay. And that is easy to pay. I mean, the $500 is easy to pay. Okay. It's better than the $700 a month to get the freaking Obamacare bronze package high deductible plan, which is just a fucking crime. That is just the government reaching in my pocket so I can just pay them for nothing, okay? This is the crime of Obamacare. This is what gets lost in the whole discussion of Obamacare is the actual cost it costs people to pay for this bullshit coverage, okay? You're paying for a fucking medical insurance cartel. Okay, of all the big insurance companies, there's no free market in here. There's no, players driving the prices down to stay competitive. It's just a cartel of the biggest insurance companies who create their own marketplace. Okay, it's like going to a high-end mall and being forced that if you want to buy clothes, if you just need like a hoodie or a pair of jeans, you have to go to a freaking high-end mall and pay $300 for a pair of jeans. And then they force you to get the buckle. And you're like, I don't need a buckle. These jeans contour me fine. Oh, and by the way, the jeans, they're like Wrangler jeans. They're not like nice jeans. They're not like, studded with dragons on the ass and, fucking rips in the knees. No, they're bullshit Wrangler jeans that, yeah, they might last you a couple years, but they're like mom jeans. They don't fit right. They're tight in the crotch. They got weird, patterns on them. They even have a button fly. Jesus Christ, guys. Button fly. Really? What are we doing with the button fly? That is what Obamacare marketplace health insurance is like, when it's way more sensible to have a free market of healthcare providers who can stay competitive with each other, and so the prices get dropped. This is why pharmaceutical companies and health insurance companies are being traded for so much money on the New York Stock Exchange and the Dow Jones and the NASDAQ, because they've created a marketplace where they can basically just name their prices, and we are fucking prisoners who have to pay that shit. And then, God forbid, you don't want to get that shit, you have to pay the individual mandate, or you used to have to, which is, I think it was like $2,000 a year or something like that. And that was actually more sensible to do than actually getting health insurance, especially because I'm the type of person who doesn't go to the doctor, okay? Now, I get some of you a-holes are the type of people who go to the doctor, but you need to end this thinking that the doctor's keeping you healthy. The doctor is not there to keep you healthy. Holistic a-hole is there to help keep you healthy. Functional health professionals, personal trainers, nutritionists, dietitians, they're the ones who keep you healthy. The doctor just looks at you and puts a patch on and chases the symptoms around and takes your money. They put Band-Aids on things, okay? And they're a business just like everybody else's business, and they're pushing pharmaceuticals on you. And they're pushing surgeries and they're pushing tests on you that you don't need if you just learned how to manage your own health, right? Not to mention, okay, even if you have health insurance and you go to the doctor, okay, like me, okay, and I know I live in New York, so the insurance here is way higher because I live in this dumb liberal state that, everything has to be overtaxed and overburdened with money and nothing can be affordable because everything's fucking expensive. So maybe if you live in like Idaho or you live in Oklahoma or you live in Oregon or Alabama, maybe your costs are cheaper, but still, we're talking cost of living. $400 might be just as expensive in South Carolina as $700 here is in New York City. And that's just for the card, right? That is just for the health insurance card. That doesn't cover anything, right? Because you go to the doctor and like for me, the $700 was the bronze plan, the high deductible plan. So I'm spending over $8,000 a year before I get any insurance, okay? Because that's the fucking that's without the deductible, okay? Now you factor in a $5,000 deductible, sometimes an $8,000 deductible. I've seen $10,000 deductibles. I'm getting close to paying $15,000 to $20,000 a year before any insurance kicks in, and that might even just cover 80%. right, of the bill. That doesn't include co-pays. That doesn't include the co-insurance, So, yeah. I had to pay the individual mandate. And by the way, the individual mandate was full-on criminality, okay? And the excuse that people make is, well, the exchanges don't work unless everybody pays in, even the people who don't have health insurance. Oh, okay. I didn't know that's how shit worked, right? That'd be like, okay, you have Costco, which is a grocery store, which is like like one of these big box, grocery and stores that sell stuff, right? And it would be like if people went to Costco because they know they could save money because they could buy things in bulk. And then, the only way that Costco could keep those prices low is if people who didn't go to Costco also paid them like $100 a year. And Costco was like, yeah, the only reason we could keep these prices low is if people who don't even come here in the first place also pay us money. Okay? This is the same thing that the fucking Obamacare health exchanges, sick exchanges, were doing to people. So this is like my number one problem with this idea of universal health care and health exchanges and Obamacare. And people just want to do this sob story that it's like, oh, well, my cousin was able to beat cancer because they had health insurance. No, they beat cancer because, I don't know, they had chemo, right? They maybe started eating right. They took care of themselves. That's amazing when people beat cancer. But it's not because of health insurance, okay? I would imagine you're not looking at their health insurance bills because I know people with health insurance who have had cancer and still had insane amounts of bills, okay? This is also, by the way, why people get stuck in these, dead-end jobs and office jobs that just suck the life out of them, because the only way to get a reasonable health insurance plan is to have it funded by your employer, okay? This is the only way health insurance works. When I had an office job, by the way, for a healthcare company, yeah, I paid like $50 a month for health insurance, for really, really good coverage. But I hated my fucking life. I hated my life. I was stressed. I was overweight. I had acne. I had bad breath. I had fucked up digestion. So I was not healthy, even though I had health insurance. And not to mention this huge growing gig economy that people are becoming a part of. You have people making livings driving for Uber and walking dogs and starting their own small businesses and starting internet companies or renting their places out on Airbnb. This is the beauty of living in the 21st century, which is the whole landscape of employment is changing. So do those people not also deserve health insurance? Because those are the people like me who were getting billed $500, $600, $700 a month to be a part of this healthcare sick care exchange. So this is my underlying problem with the idea of everybody just having health insurance. And unfortunately, I don't have time on this podcast to get into the point that I wanted to make originally. But like I said at the beginning, this is going to be a two-parter. So hang on to your shorts, everybody. Listen up tomorrow, because tomorrow I'm going to give you my counterpoint to the point that was made to me about why uninsured people are the reason why all the healthcare costs are going so high. So thanks so much for listening. Again, make sure you tune in tomorrow for the follow-up to this podcast. If you love the podcast, please, 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 it's so helpful if you do this. Go to iTunes, go to Apple Podcasts, leave the podcast a 5-star review. Also, make sure you join the Holistic A-Holes Facebook group and share the podcast on social media. If you love it, if you want people to know all this information that you're loving yourself, share this with people you love. Talk about it at your family dinners. And if you're new here, make sure you go back and binge through all the podcasts and hit the subscribe button. I'll catch you on the next one. Peace.